Hi everyone. Today I want to talk about a subject that bothered me for quite some time now, and there is a reason why I came to talk about steroids and usage of steroids in bodybuilding, from natural bodybuilding to enhanced bodybuilding. It happens every now and then, not often, fortunately, that athletes can be tempted to use steroids after a while of training and even competing naturally, and then they are by a way or another convinced to go use steroids, not realizing how much damage that can do. Some of them think that a small amount of usage or just for a short term will not affect that much their health. So today I would like to make a short introduction about endocrine system. I'm not a physician, I'm not a specialist in the system, in the subject, but I have been affected personally by the usage of steroids through the death of a very close person to me who used to use it and compete in bodybuilding. So since then, I have been more interested in the effects of steroids in human body, in athletes, and how that can affect for long term, but also on short term. So first of all, I would like to talk about what endocrine system is and the fact that it's a network of glands that produce and release hormones to regulate various body function, and that includes metabolism, growth, mood, and reproduction. The key glands that are in the system are hypothalamus, pituitary, thyroid, adrenal glands, pancreas, and gonads. These are the testes and the ovaries. When a small amount of steroids, such as anabolic steroids or corticosteroids, are introduced in the body, they can have several effects on the endocrine system. The negative feedback on hormone production can be that body regulates hormone levels through feedback mechanism. Exogenous, so external steroids, can signal the brain, especially hypothalamus and the pituitary gland, to reduce normal hormonal production, and particularly testosterone and cortisol. In men, even a small amount of anabolic steroids can suppress natural testosterone production. And for women, can conclude to less estrogen and automatically dysfunctions in the cycle and menstruation. The effects of adrenal glands, we are talking about now about corticosteroids like prednisone. When used in small amounts, they can suppress the adrenal glands' ability to produce cortisol. On long term, this can lead to adrenal insufficiency. This means that you are not so much more able to control the stress, and you are not also getting signaling for stress. This is so important because you are not able anymore to react properly at different factors, external factors that can damage your body. So body starts to struggle to respond to stress properly. The temporary and mild side effects, the small amounts of steroids may cause mood swings, the slight fluid retention, increased appetite, or can have mild changes in blood sugar levels. If the usage is discontinued quickly after a longer period, there may be a withdrawal effect like causing fatigue or hormonal imbalance. On longer term, even a small amount was used, the endocrine system can be affected and may struggle to return to its normal function, leading to a long-term imbalance or dependence. So it's not like using for a very short time the effects are not there. The effects can last for the rest of your life. And I would like to refer now to a list of most popular anabolic steroids known in the world of bodybuilding and their effects. And for this, I'm gonna really read most of their names and their effects. I never try to remember exactly their name and their effects per each type, due to the fact that I never have been tempted to try them. But more people should get deeper in this subject, not only to be aware of not using them, but also to try to help others not to do it when the subject is brought into discussion. We know that there are a lot of young people in the gyms that are talking about it, and they will be honest sometime with their friends and tell them what they are doing and what cycles they try to use or they started to use. And I think their friends are also responsible to prevent damages that may occur in these young people by telling them what not to do and why they should be very careful in what they introduce into their body. Let's not forget that when a physician or a specialist is recommending corticosteroid or steroid, is to fix a problem that exists in the body, is to resolve a deficiency. And when the body doesn't have a deficiency and one steroid is introduced with no reason, then this one will only have bad effects, damaging effects. So we are talking about testosterone as one of their anabolic steroids, and they have different forms like cypionate, anatonate, propionate. The effect of it can be increased muscle mass, strength and endurance, enhanced libido, and improved recovery. The side effects might be water retention, acne, high blood pressure, gynecomastia, hair loss, and mood swings. Another known and popular steroid is Dianabol or metandrostenolone. The effects of this steroid can be rapid muscle and strength gains, increased protein synthesis, and the side effects can be water retention, liver toxicity, high blood pressure, and estrogenic effects. Anadrol or oxymetazoline is another one. Effects can be extreme muscle growth, increased red blood cell production, and enhanced endurance. And as side effects, liver toxicity, severe water retention, high blood pressure, headaches. Trenbolone, also very known due to some influencer on YouTube. It's even more known between the young people, known also as trenbolone acetate and enanatate. Effects can be extreme strength and muscle gains, fat loss, increased aggression and intensity. The side effects: night sweats, insomnia, aggression, cardiovascular strain, progesterone release effects. Decadurabolins or nandrolone decanoate. As effects, this can have joint lubrication, lean muscle mass, increase the red blood cells, enhanced recovery, and as side effect, suppressed natural testosterone. Decadic, this is known for libido issues and water retention. Winstrol or stanozolol, as effects, it can make you more lean, get more muscle gain. You can lose easier fat and increase the vascularity. The side effects you can get as joint pain, liver toxicity, cholesterol imbalance, and hair loss. Another one very known also between women is Anavar or oxandrolone. As effect, you have mild muscle gains, fat loss, minimal water retention, and as side effects, again, liver toxicity, less than other, but cholesterol imbalance, hair loss, also if predisposed to it. Boldenone is another anabolic steroid, and its effects can have steady but lean muscle gains, increased appetite, and improved endurance. As side effects, again, the increased red blood cell count can thicken blood and potentially anxiety and mild water retention. Masteron as a face can have as a hard and dry look, again, like more easy to lose fat. It has anti-estrogenic effects, can improve muscle definition, and a side effect is the hair loss again, joint discomfort, and cholesterol imbalance. Primobolan, also quite known as an effect, can have lean mass preservation, fat burning, and minimal water retention. And a side effect, mild suppression of natural testosterone. It's quite expensive and also less dramatic results. Yes, anabolic steroids can have side effects even with short-term use, while the severity and likelihood of side effects depends on dose and the duration of usage. The individual genetics and other factors, some common short-term effects can include water retention and bloating. This is what you heard for many of them, or almost of each of them. This gives that puffiness of your aspect, and in the especially in the face and midsection. They also produce more acne and oily skin. You can recognize this if you see people with a lot of acne on their back and shoulders. The mood can change. This is what you heard about, referred as roid rage. Elevated aggression and irritability, anxiety also combined with it, and the mood swings can occur between these people that use the anabolic steroids. It's also known as one of the effects, the insomnia and restlessness. Some steroids, particularly the trenbolone, can interfere severely with sleep. The high blood pressure, this is a very, very serious effect. Increased red blood cell production and water retention can also elevate very much the blood pressure. So the water retention is not only in the aspect of your face, of your middle section. This has effects on how your blood flows through your body, and how much the effect can be on a heart attack due its high pressure. Testosterone suppression, even on short-term use, the anabolic steroid can reduce the natural testosterone production, leading to a very low libido and sluggishness after stopping. Headaches. Some users experience headaches due to increased blood pressure or hormonal fluctuation. The digestive issues, some steroids may cause nausea, bloating, or appetite changes. Gynecomastia, known as gyno of man boobs, this is an effect due to estrogenic steroids like Dianabol and testosterone. This lead to breast tissue to grow, and if not managed properly, it can also be operated with a surgery for aesthetical effect. It's not still desired. Cardiovascular strain, even on short-term usage, the steroids can affect negatively the cholesterol levels, lowering the good, so-called good cholesterol, the HDL, and raising the LDL. So, are the short-term side effects reversible? Most short-term effects subside after discontinuing steroids, but recovery depends on proper post-cycle therapy and overall health. Very, very important is the genetics and how your health in general is before any usage of it. Things that you might not know about your predispositions or your tendencies. If your body is more predisposed to have issues with your heart or the high level of cholesterol, all this can be enhanced and out of control when usage of steroids. Now the question is, a short-term usage will improve your physique drastically, or even a long-term usage will that necessarily come with the usage of steroids? People think that if they didn't reach a certain level in their physique, a certain look, only that will make it to improve, and almost with certainty will change it dramatically to look like an Olympic athlete and like a top 3 bodybuilder in Olympia competition. But it's not necessarily the case, and more probably it will be that if you don't have the genetics for a muscle freak, the effect won't be that drastic, that visible. As a consequence, you'll go for more thinking that the dosage or the period was not enough, and in no time you will abuse them, making this way more sure that you'll suffer serious consequences. All steroids are used in medical world as treatment for different diseases, as I said it in the beginning, or deficiencies. When taking them without sickness, you can only create a problem. You take your body out of its homeostasis, out of its balance. By using another drug to eliminate or downside the effect of a steroid, as high blood pressure, by example, you can only get further in damaging the body's welfare. Do you still retain the muscle mass after stopping with steroids? Well, when you stop using steroids, you would likely lose some muscle mass, or quite a lot of it, that you gain during usage of the anabolic steroids. But the extent of the loss depends on several factors, including how much muscle you gain, how long you use the steroids, your genetics, and how well you manage the post-cycle recovery. So what happened after stopping the steroids? You will have the loss of water retention. Many steroids like the anabolic and testosterone cause water retention. When you stop, this water weight is lost, making muscle appear smaller and less full. As we know, muscles are retaining a lot of water, and that's why they are increasing their volume. It's not like you add fibers in a muscle when you're training, but you make them to swallow, so that's making them to become bigger and have more impressive kind of look. When losing that water determined by the medication, by the steroids, you also lose the volume of it, and including the aspect. The natural testosterone suppression. If you stop using certain anabolic steroids, the suppression of the body natural testosterone, if not managed properly, will lead to muscle loss, fatigue, and lower libido. A proper post-cycle therapy can help restore hormone balance. Sometimes that balance, it's never back, so you will be depending on therapy and on replacement of your natural hormone for the rest of your life. The strength reduction. Without enhanced recovery and protein synthesis from the steroids, your strength will decline, though not necessarily back to pre-cycle levels. The muscle retention with training and diet. If you maintain consistent training, proper nutrition, and recovery, you can retain a significant portion of your gains. However, muscle gain from steroids is harder to maintain naturally. On long term, if you trained for years before using steroids and had a solid foundation, you may keep more muscle mass than someone who used steroids early in their lifting journey. So, how to keep muscle after a steroid cycle? A post-cycle therapy will use compounds like Clomid or Nolvadex to restore the natural testosterone. Again, it will be possible, and if your body will be capable of recovering that. I was searching through internet in the most easy way these days by asking ChatGPT, and when I asked if it's worth taking steroids, as a result, I got pros and contra about it. As pros, the only worth it reason was the looks, the loss of fat, the size of muscles. And as cons, I received a more varied answer. I'm gonna tell you now what I got as a answer for the cons. As health risks, heart disease, liver damage, kidney strain, high blood pressure, and cholesterol imbalance. As hormonal imbalance, natural testosterone suppression, potentially infertility, and long-term hormone dependency. Psychological effects, mood swings, aggression, the roid rage, anxiety, and depression post-cycle. So let's not see the downside of the usage, but also what's happening after you stop. As legal and ethical issues, steroids are illegal without a prescription in very many countries and banned in sports. As possible permanent side effects, gynecomastia, hair loss, and the cardiovascular damage that might be irreversible. So considering all these effects and side effects and risks, I don't know if it's smart at any moment in your life to consider the usage of steroids. I would like to address to all natural athletes to stay natural, to train smart, to train hard, to come back to your drawing table every now and then to see what you can improve in your athlete journey. And even if you still compete or you stopped competing, to realize that the usage of steroids can only damage and put to risk your life. I don't want to have anybody else in my life that I know personally or just know to lose. And I hope all the smart athletes out there will listen and follow these advices and look for what's healthy or what's improving the quality of life for long term till the end of their life, that will be long and prosper and strong. And as an example for many others after us, the new generation that can just repeat it and bring it further. Be smart and train hard.